Hello, my name is Judy Mashira. I'm going to be recording a neurological assessment for NU659 Neurological, and this is my volunteer Samuel. Do you give us permission to do this recording?
Yes, I do.
First thing is to do hand hygiene, introduce myself to the patient, and ask a few questions. So, how are you doing today?
We're doing very well, thank you.
Do you have any pain anywhere?
No pain,
Any dizziness or fainting?
no dizziness and fainting.
Okay, and the last question is, do you have any numbness or tingling anywhere in your body?
Yes, I have some numbness in this part of my face.
Okay, do you know why?
Recently diagnosed with a condition called Bell's palsy.
And that is a neurological problem, so he's been getting his treatment and he's going on with that therapy there. So the first thing we're going to assess is the sense of smell. So we are going to assess your sense of smell, and I'm going to ask you to close your eyes and tell me what you can smell.
Garlic?
Okay, this is garlic. Can you breathe in with that side?
Yes.
That's clear. Is that okay?
Yes.
Okay, so his sense of smell is good. That's cranial nerve number 1. Then cranial number 2 is vision. We're going to test vision using a Snellen card, and you're going to hold it 14 inches from you and tell me which line you can see the most clearest.
I can see this one right here.
Can you read it?
Yes.
Mm-hmm.
It's 428365 WEM
Okay.
OXO63.
Perfect. So his vision from this card is 20/40, and do you wear corrective lenses?
No.
You do not? Okay. So you probably need them at some point. You can see an ophthalmologist for corrective lenses. The other nerves that we're going to check is cranial nerve number 3, 4, and 5 and 6, and these are the movement, the eye movement. So I'm going to ask you, look at this finger and do not move your head, but you can follow the finger. So his oculomotor is intact, and we're going to go straight to cranial nerve number 7, which is the facial expressions. So I'm going to ask you to do a big smile. So because of his Bell's palsy, his smile is not symmetrical, and that's expected because this side is stiff and numb. And I'm going to ask you to close your eyes tight, and we're going to try and open them, and this side we can see the weakness, so that is a perfect example of cranial nerve 7 being affected there by the Bell's palsy. So the other thing we're going to ask you is to puff your cheeks. Okay, again you can see the difference on this side. Puff them this side, the hardest you can do. Alright, so he's continuing with his therapy, and he's getting better every day. The other thing we're going to ask you is to close your eyes. I'm going to touch your face with something. You tell me if it's painful or dull, okay? Sharp or dull?
Dull. Sharp. Dull. Dull. Dull.
Okay, so that side you can see the difference.
Sharp. Sharp.
Okay, that's dull. Okay.
Sharp. Dull.
And the last part we're gonna do this part.
Dull. Dull. Dull.
Alright, so there's the sense of sensation on his right side of the face is affected by Bell's palsy again, like we said. The next thing we're going to check is your voice. You can say 1, 2, 3, 1, 2, 3.
1, 2, 3, 1, 2, 3.
So we are trying to sense a nasal effect of his voice. So the next thing we're going to check is your palate. That is vagus nerve, cranial number 10. Can you open your mouth wide? So we will put this tongue depressor and It's not very clean, so we're not gonna use it, but it brings out the gag reflex. To make sure it's intact on a normal patient, we would use a clean, disinfected tongue depressor to do that. We're gonna also check cranial number 11, which is shrug your shoulders as much as you can. And I'm gonna press you, shrug them. Good. So that nerve is intact. And the next thing we're going to do is check cranial number 12, which is the tongue movement. So stick out your tongue, move it side to side. Good. Lift it up and down. So that's the tongue is intact. There's no atrophy. It's symmetrical and healthy. It has no lesion, bulges, or any wounds or open sores. So that is the 12 cranial nerves that we have checked. The next thing we're going to check is your strength in your hands. So you're going to hold your fist like this, and I'm going to pull them, don't let them. Then I'm going to push them, push back. Good, that is perfect. I'm going to check the muscles. There is no atrophy, there is no problems with the muscles and nerves. The hands are intact. There is no atrophy on his hands. He's strong. You can see that. We're going to check the legs. I'm going to lower the camera. So I'm going to push, but don't let me push you. There's strength there. I'm going to pull you. Push back. Good. We're going to check the legs. Dorsiflexion. Let me push. Don't let me push you. Push back. Resist. Resist. Good. Resist. So dorsiflexion and flexion are intact on his legs. The next thing we're going to check is we're going to check his reflexes on the patella tendon. Good. Okay. Then you're going to check the hands. Just relax your hand. Just relax it. Okay. So you see that he has all his reflexes intact. So the next thing that we're going to check, I'm going to adjust the camera, is the coordination. So I'm going to ask you to touch my finger and touch your nose. I'm going to move it around. Okay, do this. And move it and touch your nose, okay? Alright. Touch it and quick, faster. Good. Alright, the next thing you're going to check the coordination of your fingers. Do this rapidly. Both hands. Back and forth. Back and forth. And you're going to coordinate your hands to see how fast you can do it. You're going to adjust the camera again. Okay, on your up, keep moving that. Good. So his muscle coordination is intact. So we adjusted the camera to do the tandem walk. So you're going to walk, put your heels behind your toes behind your heel and walk on a straight line. We're just checking for coordination. If you can not hold on something, we just want to see your coordination, and that is good. All right. Then the next thing we're going to do is to adjusting the camera is to hold on. Next thing we're going to check is vibration and sensation on his toes. So I'm going to ask you to close your eyes and tell me what you feel. Okay. I'm going to put something. Do you feel pressure or vibration?
Vibration.
Okay, let's see the other hand. Put it up. The other leg. Put it up. Do you feel pressure or vibration?
Vibration.
Pressure or vibration?
Vibration.
Alright. So his sense on his legs is intact, and we see lots of senses in diabetic patients. The next thing we're going to test is his pronated drift. So you're going to stand up. And you can face this direction so that the camera can close your eyes and bring your hands out forward. So we're going to check if there is any drifting on the hands, and there is no drifting. They are not falling off. So his balance is intact. You can sit back. You're gonna close your eyes, and I'm gonna draw something on your palm of your hand to check accuracy, and you'll tell me what I drew.
3.
Good.
E.
Good. So his sensation on his hand is intact. So the next thing we're gonna do is to go back to the cranial nerve that we missed, and the first one is the trigeminal. So you're gonna clench your teeth tight, and then move your jaw sideways, back and forth. The jaw, open your mouth and jaw. Okay, so that is trigeminal, and we also, while assessing for the cranial nerve number 2, we also need to check the fundus of the eye by making sure that his nerves and veins are healthy and the fundus is healthy. So we're gonna do that. Just look forward. So we have to check the retina, and we can see that all the veins in the arteries are healthy. There is no edema or any problem in his eye. So that is the end of neurological assessment. As we can see, our patient has some deficits that are already being treated, and thank you for volunteering today. Before we end this video, there's one other cranial nerve that was skipped, and that is the hearing, cranial nerve number 8. So we're gonna do the whispering test, and I'm gonna check if he can hear accurately or he has any deficits. What did I tell you? Repeat what I said.
99.
What did I tell you?
Hollow.
So his hearing is good via the whispering test, and that's the end of the video.